A new week has dawned in the era of COVID-19, and the pandemic keeps burning through the U.S. population. Infections across the nation are near 160,000 and still rising, with some 3,000 deaths. The spread has now put Washington, D.C. and its neighboring states into lockdown, and New York State is urgently appealing for outside help. We begin with this report from Amna Nawaz.
At the epicenter of the U.S. coronavirus outbreak, New York undertakes new steps to care for the continuing tide of patients as state health officials anticipate a peak in 2 to 3 weeks. New York Governor Andrew Cuomo.
You have to prepare before the storm hits. And in this case, the storm is when you hit that high point, when you hit that apex. How do you know when you're going to get there? You don't. There is no crystal ball. But there is science, and there is data, and there are health professionals who have studied this virus and its progress since China.
The death toll here has now exceeded 1,200, and known confirmed COVID-19 cases surpassed 66,000. As New York's healthcare system overflows, help arrived today on the Hudson River. The U.S. Navy ship Comfort docked in Manhattan, bringing with it 1,000 hospital beds for non-COVID-19 patients. Part of New York City's Central Park, normally bustling in the springtime, is now crowded with white tents, a makeshift field hospital to handle an influx of patients. And at the Javits Center, lines of empty hospital beds. A convention center is now a clinic in waiting. New York is not alone in seeing a rapid increase in cases. Across the country, surges in cities like New Orleans, Detroit, and San Francisco are straining healthcare systems from coast to coast. Officials in Michigan saw an increase of 1,800 cases in just 2 days.
We are still in the early stages of spread in Michigan, and cases have not yet peaked.
Washington, D.C., Virginia, and Maryland became the latest to issue stay-at-home orders. Maryland Governor Larry Hogan.
No Maryland resident should be leaving their home unless it is for an essential job or for an essential reason, such as obtaining food or medicine, seeking urgent medical attention, or for other necessary purposes.
Even President Trump, once eager to reopen the country by Easter, is now extending federal social distancing advisories for at least another month.
We picked the end of April, the last day, April 30th, as a day where we can see some real progress, and we expect to see that. And then by a little short of June, maybe June 1st, we think it's a terrible thing to say, but we think the death will be at a very low number. It'll be brought down to a very low number.
That number, White House experts say, could still be up to 200,000 dead. Meanwhile, overseas, more measures to stop the spread. Empty streets in Moscow as Russia locks down, prohibiting any non-essential outside movement. In India, the sweeping 1.3 billion person lockdown continues. And in Spain, where known cases now top 85,000, a sign that social distancing is starting to work.
From the day that the general social distancing measures began throughout Spain, from the 15th to the 25th of March, the increase in average cases was about 20%, and since that day, it is about 12%.
The World Health Organization warned that worldwide, the most vulnerable communities will be the hardest hit.
If we're closing or if we're limiting movements, what is it going to happen to those people who have to work on a daily basis and have to earn their bread on a daily basis?
Back in the U.S., the economic hits keep coming. Today, department store powerhouse Macy's announced it will furlough most of its roughly 130,000 employees, leaving tens of thousands of more Americans facing an uncertain and uneasy future. For the PBS NewsHour, I'm Amna Nawaz.
Wall Street, for its part, rallied again today, led by healthcare companies working on potential coronavirus tests and vaccines. The Dow Jones Industrial Average gained 690 points to close at 22,327. The Nasdaq rose 271 points, and the S&P 500 added 85.